Hello. Let's give it a few minutes to see if anybody's going to come in. Excuse my house. We're in the middle of reorganizing and moving things around. I'm doing a complete rehaul of my house. I'm also using a different webcam, so I'm going to check on my phone and see if I'm getting audio. So please wait a moment while I do that. Okay, perfect. We have audio. It's a very clear picture. I'm very happy with this cam. If anybody's interested in what model it is, please let me know and I will show you the camera, where I got it, what it cost. It's a very clear picture. It's a very wide picture. And it's picking up just how bad the destruction in my house is right now. Sorry about that. Today's discussion got off a little later than I expected. Right now, one of the problems that I wanted to discuss is exactly the problem as to why I'm having this topic. Right now, I do not have any Lantus, and I'm supposed to be on Lantus. I get a 90-day supply every 90 days. This is part of the issue is I'm constantly out of one of my insulins, and I'm having to make up for that in other ways or in the hospital with pancreatitis because I'm a type 1 diabetic. And the problem is my insurance company is owned by my provider for my medicines. Now, isn't this a conflict of interest? This is what I'm saying. It's a conflict of interest. How can they allow it when they say that other businessmen cannot own certain businesses because it's a conflict of interest? This is my problem. This is what I want to talk about. If there are businesses that cannot own other businesses because it should be illegal, then how can they allow a big pharma company to own an insurance company and then dictate to them that your clients can only get their prescriptions filled using the people that own them? To me, that is highly illegal, highly suspect. It's coming out that people that are diabetics are dying because they're not getting their insulin. And it's not because I can't pay my payment. It's not because I'm not trying to order it. It's because they're telling me, oh, we don't have it in stock. My insurance I've had for 27 years through my husband's employer. I have a very good insurance because, they charge $350, $400 a vial if you don't use insurance or any kind of health coverage. Sorry. For insulin. So, we're the only country, one of the only countries that do this. When insulin was made, the guy that made it and patented it, he gave it for free because he said he did not want anyone to not have access to insulin. But they're saying we have to charge this much because that's what it costs us, but it doesn't cost them that. Insulin is a very cheap to produce drug. It's a lie. They're making money on it. I also have MS. I have a friend that is in pharmaceuticals. I've asked them before, why did they stop? You remember when MS became this big thing, donate to MS, do MS walks, let's find a cure. Why did they stop that? She said, because there's no money in it. Why did it take so long to cure or find medications for AIDS? Because they were doing all this fundraising. It was making money. Why have they not gotten better at curing cancers? You know I've had cancer, right? I'm going to go through more on that in a little bit. I had hoped to spend longer on this live, but it was late getting started because I had problems setting up the new camera. It's harder for me to think and process right now because I'm having insulin issues. So that combined with my MS causes me to have problems. So I'm going to have to do another live about this because I'm not as organized or able to communicate as best as I had hoped. So I did put a lot of links in my my tabs. That way people can go and research some of the stuff that I have medically so they can get a better understanding as to why I'm hard to communicate verbally. I can type and do things like that much better than I can verbally. Verbal communication is very difficult because I have MS. And if you don't know what that is where the myelin sheaths on your nerves, in your brain and in your spine have been attacked. Matter of fact, it's here on one of my mugs. This is the nerve endings. And it gets attacked. And it's like a stripped wire would be on a vehicle or something. It's like bare wires because it strips the covering off. And what happens when you have a stripped wire somewhere and you have a bare wire? It either starts a fire or it rubs up against something else and it disrupts the communication. So it makes it very difficult to work or function. So I have disconnects in how things function between my brain and my spine, which mine is mostly on my right side. So I can be holding something and immediately drop it, and I can't control that on my right side especially, or something on my right side doesn't function properly, or I am trying to think of something and I can't word it correctly or think of it or communicate properly and stuff like that. So it causes a lot of problems on top of the other issues that I have. So I've listed several things that I do have and I've been dealing with. Back to the pharma. Right now, I'm out of Novolog, which is my fast-acting insulin. They told me I can have it on the 28th. They issue my insulins every 90 days. I had to start calling and fussing because last time it was due for my Lantus, which they never want to give me my Lantus. That's the one I mostly have trouble with. They never want to give me my Lantus. So last time it was working on 110 days. Okay, I was out. I was going to the hospital, pancreatitis. I had to use my glimepiride and my Novolog all up. So I was running out of both insulins, and I eat a low glycemic index diet already. So I was pulling out all the stops, all the tricks to keep my sugars down. I use a Dexcom, plus my dogs are trained for glycemic alerts, and they're better than the Dexcom. They can give me a faster alert. They can tell me if it's running high or low. And yes, I am asthmatic too. I actually have a lot more breathing problems than that. because with my other conditions, I go through flares and I get pneumonia, which causes scar tissue in the lungs. So I didn't list every problem I have. And so anyway, it made me have to use a lot of my Novolog for this 90 days because they were late giving me my Lantus last time. So they don't want to give me they didn't give me any extra to cover, of course. And they're shorting me all the time. So I'm always at a deficit. They've had people die because this is how they treat us. Or they'll tell us at the store, I get the mail. I get the mail to me because at the store they constantly tell you they don't have any, which is bull. They want to sell it to people that are paying a higher price. They don't want to sell it to you if you're insurance and you're paying a lower cost. They want to sell it to whoever's paying the higher price, so they meter it out. If you go and research, CVS is who I have to get it through. I have no option. I have to get it through them. So if you research, they're one of the 3 that are in major trouble right now for these behaviors. They also do it with cancer drugs. Anything that makes them money, CVS is in trouble. The quality of the medications I've been getting over the last multiple years has become so bad. I used to get my medications at Rite Aid before they stopped allowing me, and now Rite Aid has gone out of business. So many pharmacies have gone out of business ever since CVS has stopped allowing us to go other places. Ever since they stopped allowing us to fill our medications at other places, the other places have gone out of business. That can't be right either. All right, beyond that, I want to get into the whole Hippocratic Oath thing. The part that upsets me is having the part that says privacy. We need to talk to each other. We need to open up about what the doctors say, what they do, what the hospitals are charging, what they're saying to us, how they're caring for us, because that's how they're keeping us controlled in our medical. People don't know that the doctors keep 2 logs. They keep one that you may see some of, and then they keep one you don't. And that's how the doctors are predetermining and prejudging you before you even see them. When I was diagnosed with cancer, they sent me to the first oncologist. I knew I had cancer. This is before my operation. I was diagnosed cancer. We all knew I had cancer. There was no, you're going to the oncologist to see if you have cancer. This was a fact. I was cancerous. They were sending me to the oncologist because there was a secondary possible cancer that we were concerned about, which turned out to be yes. They were sending me for that. I was already scheduled for surgery on my first cancer. This oncologist that they sent me to was a pompous ass. He looked at me in the wheelchair. He looked at my service dog. He looked at me. He looked at my weight, which if you don't know, I have had thyroid disease all of my life. I see my dog stretching in a beanbag, sleeping. I've had hypothyroidism all my life because I had Hashimoto's thyroidosis. That's what led to the cancer in my thyroid and the removal of it. And that's the other thing I want to discuss some of. So He looked at me and looked at the dog and looked at my weight, which I'm in a wheelchair. It's a manual wheelchair. I've had as much cardio as I possibly can. I don't have a private pool. I have several autoimmune diseases. I can't go get in germy water with all the germs. Sorry, not sorry, can't do it. I can't even go to the hair salon and get my hair styled because I've ended up in the hospital for 7 days with 3 antibiotics intravenously because a hair broke off here. And I had a huge MRSA infection on the side of my head, and they thought it might get to my brain. So I catch bloodborne diseases very easily. It's very dangerous. That's why they also can't do some surgeries on me, and they're afraid to do some procedures, which also causes a problem with my legs. Not going into all that because somebody calls bullshit on that, which I know what the problem is. My doctors know what the problem is. I don't care if they believe it or not. So, that's also why, I'm very careful on who I go to get things done. I have to be very careful. I can't just walk into any salon to get medical things done. I cannot introduce my body to germs. So anyway, I am heavier. We all know this. It's a fact. But it's not because of eating or what I eat or how I eat or how much I eat. Blood doesn't lie. My blood is tested all the time. My glucose levels don't lie. I have a constant glucose reading all the time. I eat clean. I'm not sucking down sugars and breads and carbs and, all of that. If anybody wants to learn how to eat healthier, I'm happy to show you some great recipes and share how to eat low glycemic index food. I am very happy to help anyone. So, that's not a problem. So this guy judges me and he looks at me, did not ask me any questions. And here is the point. We know I had active cancer at the time I saw him. And he judged me based on having a wheelchair, a service dog, and my weight. And this oncologist says, you don't have cancer. What is wrong with the medical profession these days? What is wrong with these people? Before this, do you know what it took for me to get that cancer diagnosis? If you don't have private insurance and you have them growing in your neck, you have the nodules, when it gets to a certain size and you have problems. I was going in for swallowing tests and everything else because they kept blaming my MS on me choking, trying to drink. And I was having problems you wouldn't believe because they were growing so large and I had so many of them and it was starting to look like an Adam's apple. Guarantee you, I was never born male. And it was looking so horrible. And when I moved to Georgia, I had a fabulous doctor in Kentucky that took care of my diabetic needs. When I moved here, we were preparing to do a surgery to remove even though it kept aspirating as no cancer cells. They keep aspirating because in order for insurance, it has to be a certain size or they have to find active cancer cells. So they keep aspirating inside of the nodules to find it. The doctor here took Hashimoto's off my chart and wrote goiter, which was incorrect. Then she refused to do it and was sending me every 6 months to get an aspiration. She did this for 3 years. It would have never gotten to cancer if they had just taken it out. But of course, medical is so abused for those who pay for their insurance. And we pay over $700 a month out of my husband's check for our private insurance. It's more like $900, I think. It's almost $1,000 for our private insurance before we ever even get his check. It's taken out right out the top. So then you have these people who are on free assistance. If they get a nodule, do you think they go through all those years of aspirations? No. The city and the state and the country, they don't want to pay for all those aspirations. You know what they do? They take it out immediately. They don't pay for them to go through all that testing because they're not a cash cow. People like me are a cash cow because, you know, they can make me go through all those hoops and keep charging my insurance all that money because remember, CVS owns Aetna. So they can make me jump through all those hoops and say, oh, no, not yet. We can't do that yet. So you want to know how I finally got it out? Because remember, they were sending me also for barium swallowing tests and stuff like that and say, well, maybe it's your MS as to why you can't swallow without choking. You know, and maybe that's why you're choking at night and, you know, all that. Not because you have stuff that's growing so large in your throat that it's blocking, you know? Yeah, it was that bad. So, no, I said to my doctor, who is fabulous, my general physician is the most amazing man. He's one of the few doctors that really still cares. He cares about his patients. Of course, you know, he works for, I'm not going to say the system, but they try to make him only see one patient every 15 minutes and get him through as fast as he can, like a cattle chute. And he has to do his system too, but he tries to do the very best for his patients. He's awesome. And I know you see it because my eyes are jittering back and forth. That's part of my neurological disease. I can see it happening in the screen. My neurological is a little off today. It's not as controlled. And this is with 2 seizure medications. I'm not epileptic. This is because of the MS. This is because of my nerves having the issues. But the anti-seizure medications help control the side effects. Back to what I was saying. I went to my doctor and I said, I've got to have these nodules out. I'm feeling so sick. By that time, my cancer was so bad and I was feeling so bad. But because I've had hypothyroidism my whole life, when I have cancer, I don't lose weight. So I'm not going to have the typical symptoms of low-weight cancer. But my body, I was so sick. And I could feel it. It was just so eating me up inside. I'm sorry, I'm getting emotional. I told him I was so sick, and I've seen this man for over 10 years as my doctor, and he knows me. He knows I'm not going to say I'm feeling so horrible unless I really am. And that's one of my points. You can't be going to these 24-hour docs or teledocs or this or that. You have to have an established doctor that you see on a regular basis, and you go and get a physical once a year, and you get your vaccinations, and you get all your care through. He has to be in your corner. He or she has to be in your corner medically. All your care has to come through them, because your other doctors are not going to communicate with each other. So you have to go to that person, and they have to be in your corner. You have to have a trust relationship with a general physician that knows you're not full of shit. And he knows me. I can call him and say, I'm having a flare. And I'm to the point that he will call my prednisone in. He will call my Z-Pak in. He knows I have walking pneumonia at that point, and boom, the meds are there for me. Because he knows I don't abuse it. And he knows exactly what's going on with me. And if I feel that, hey, it's a little more something than this, I'm going to tell him I need a chest x-ray. If I don't need a chest x-ray and it's just the normal, because we've been through this so many years, I'm up front with him. I'm not a drug seeker. I turn down stuff. I will not take certain things, and he knows that. I've never been on pain management. I will not. Brain fog comes with my MS so much, and with the neurological stuff, that I will not take anything. I live with pain, horrendous pain every day. But I am not going to take anything. I've had a drug addict for an older adopted brother that turned to a life of crime to feed his habit. I abhor drugs. It's not for me. So anyhow, I told him, I said, this doctor is just using me as a cash cow. I said, we've got to put an end to this. I'm sick. And I told him, I says, can we get to a surgeon directly? Even if I got to do something to raise the money, I've got to get this out. So he sent me to a surgeon. I went to the surgeon. I told him what was going on. I showed him my history. He got the information from my doctor. He said, well, I'm going to send you to a doctor over at the hospital, and he's got to do another aspiration. This is going to hurt, but we're going to dig. So he sent me over, and I went over. And let me tell you, I've been through some painful procedures. And he pre-warned me what was going to happen. And I'm not a pain wuss, but that was a bad procedure. He had 2 radiologists in there with their equipment. We had 3 nurses in there, and he was a surgeon. And he took needles and he dug all in my neck. He had already taken grafts and stuff and sonograms so he could see where the bad stuff was. And he came in and he said, yeah, I see several that look very cancerous on the grafts I took. I'm going to dig in those, and I'm going to get as much sample as I can, not just an aspiration. He says, it's going to hurt. I can't numb down in there. All I can do is give you a local on top of the skin. And I told him, I said, do what you have to do. I have to have this out. And so he dug down in there, and I stayed still, because you got to. And he dug and dug and dug. And I think I was in there for about an hour and a half, though I did feel longer. And he found samples, and sure enough, when it came through, it was cancerous. He got it, and surgery was set up, and I went in and I got it out. But it's the good doctors like that that outweigh all the jerks. But the point is it's the insurance companies and big pharma that's causing the problems to make the doctors have to do things like that in order to get proper care. So that brings me to the Hippocratic Oath. He had to cause harm in order to get proper care. It goes against the Hippocratic Oath. And the second part of the Hippocratic Oath that I wanted to discuss is the whole thing of the privacy. Privacy is not being followed anymore either. It's only being, the patient is encouraged not to say anything. My husband is in transportation. People in the transportation department, they have to take a physical. They have nothing private in their medical care. It has to be given to several departments in my husband's employer. They have to hand over all their medical. Military. If you are signed up for the military, you have no medical privacy, and they're allowed to experiment on your body. You have no rights. When you work for a large corporation, I found this out the hard way because that's how I lost my career. When you get diagnosed with a life-altering event, is what they call it, there's 3 initials put at the end of the diagnosis that show up everywhere on the paperwork, and it goes through HR and other places. There's 3 letters, and they know you're going to be costly, is how they put it, for the rest of your life for any corporation that pays medical benefits. So then they will seek to get rid of you because they don't want to pay your insurance. I have 3 of those conditions. No company will ever hire me again that is a quality company for the career that I worked. So the Hippocratic Oath is bullshit now. It's bullshit. All it does is encourage people not to talk so that they can continue to abuse and neglect the patients. It's not to protect the patients. I have put links on my community wall about all of this. Please go to those links. Get all your medical records. By law, they have to give them to you. Also, put somebody you trust in charge of getting records and getting your medical care, and get knowledge of your medical care if anything happens to you, because there's a lot of medical malpractice. I always screenshot all of my notes from my doctors right when I have the visits. I cover my ass. I screenshot it, I print it out, and I keep a medical journal because they've gone back and redacted. They've cleared that out. Same with my pharmacy. They've gone back into the app, and where they were giving me my insulin every 110 to 20 days, when they were supposed to give it every 90 days, and I was running out and I was ending up in the hospital with pancreatitis, they've cleaned that out of the app. Now it says, oh no, Mrs. Brown got that every 90 days. Oh, matter of fact, she was getting it every 88 days. Nope, Mm-mm. I've got it all printed in my journal, right from the app. Shows. Plus, I have my bank statements where it was paid for at 120 days. It goes to court. Where's the proof? Here it is. Working in a corporation that already fucked me over, I learned that shit. Sorry for my language, not sorry. You cannot trust any pharma, any corporation, any of them. All of these medical things, the Hippocratic and, oh, don't talk about it, and all this, no, it's only to protect them. It's not to protect you. And HR is only to protect companies. It's not to protect the employed. Don't trust them. Do not trust HR. And forget Sedgwick. If your company has Sedgwick, forget that crap. And the whole law system that's supposed to protect people with epileptic or anti-seizure meds or any of those medications that's supposed to be protected by law that they can't be gotten rid of, forget all that too. You're not going to be protected against. You can't go to court and be protected. No, that doesn't happen. You have to be an independent millionaire in order to protect yourself. I found that out too. Yeah, so I'm a little spicy about all this still. So why do I go around and why do I try to give people information? Because I've been fucked. And it didn't feel good. That's why I educate. I loved my career. I absolutely loved my career. I worked hard to get my position. And I worked hard to keep it. Never did my stats fall. I was fully disabled while working, and I loved it. And when I was on the seizure meds and first put on seizure meds, they told me I should go ahead and apply for disability. And I told them, why? I'm working. I'm able to do my job. I didn't get it because nobody said anything. And this is why they don't want you to. This is why they don't want you to say anything, because it protects them and you get screwed. So you know what? As a married woman, I'm here at home. And as a married woman who is married to a man that makes a decent amount of money, you also do not qualify for disability. Even though you had a career and you paid into the system, you don't get it back. I would have to divorce my husband and leave him in order to get the money I paid in. I would have to destroy my marriage of over 30 years to get disability. Yeah, they don't want you knowing any of this. And I mean, it's ridiculous. Do you think that in today's society and today's money, that their limit of what one person, even a well-paid person, covers what two incomes can do with all the medical bills of one person in the house who has all the medical conditions I do, and we pay for our medical insurance. I'm 56. He's younger than I am, but only by a year. The retirement age is 72, 62? I forget. We've put money away, but you can't save enough money anymore to fully retire. People are working till the day they die. I mean, I have set up that this is not going to be the only talk on this because, it was late start. I've put links up. I want everybody to watch this. I want you to email me on that email I set up just to contact me. It is not connected to anything else. You can make a fake email just like I just made that one email just for this. That's connected to nothing else. And if I don't know the answer, I will research it. What else have I got to do? But basically, we get through things because I'm a frugal person. I don't go out shopping for anything and everything. I garden and I freeze and preserve and ferment. I have chickens that lay eggs. We are very cost saving around here. Our house is set up so that it is low energy, cost saving. We don't eat out very much. My son, he doesn't pay rent, but he helps in with the bills here and there. Plus, he's saving up for his own life. But he's determined one person cannot live on their own very well. And so we've determined we're not staying at this house for the rest of our life like we thought. We're moving to another state. I'm not disclosing where. So he is probably going to have an option. I'm not going to say what, to stay near us or have a place beside us or on the same property. We don't know how that's going to work out yet. We've got time on that. And we have 2 areas we're looking into where we're going. And that will never be disclosed on here or when it happens. But we're basically sorting through stuff and preparing. But we're not staying here. When the movie industry came here, it raised property taxes so astronomically. It's crazy. The reasons we came here to retire, it's destroyed that. And the other medical needs, the medical here sucks. It really sucks. I went into a new neurology office, a Dr. Reginald Hall's office. Yeah, I'm going to out him. I walked into his office, not walked. I went in my wheelchair into Dr. Reginald Hall's office. I left my service dog home for this visit because he's right up the road from me. And he was the biggest jerk ever. I paid my fee, my copay. I went in. When he called me back, I told him, he goes, "Why are you here?" I told him I needed a new neurologist, and all my information was there. He knows what neurology medicines I'm on. He says, "You're not epileptic." I said, "No, but I'm on epilepsy meds because it helps my neurological issues." And I told him I have MS. And he just started rapid firing questions at me. I cannot answer rapid fire questions because, hello, I've told y'all my communication issues. And he was pretty much just a big bully. He was a bully. And he goes, "Well, I don't diagnose, so I don't know why you're here." I've never met a neurologist that doesn't diagnose. I told him I'm just looking for a new neurologist. My general practitioner would like for me to have a neurologist. I'm not asking you to diagnose anything. I have my diagnoses. I've been diagnosed for years. I actually went to a very prestigious medical center and got all my diagnostics done, and I had a full genetic workup. Believe it or not, I know why I'm so short. I actually have a rare genetic condition in my genome. I'm supposed to be a little person, but I grew a little bit bigger than a little person, and I have a pituitary gland issue. And that's why I have so many medical problems, actually. Because I was supposed to be, I was 4'11" for many years, and then when they put me on some supplements and some help, I did get to 5 foot. So I grew a little bit, but my proportions are very off. I don't have proper proportions in my body still. So I'm actually kind of a little person that grew a little too much, if that's kind of a way to put it. It's got a big, long name for the genetic condition, but anyhow, Dr. Reginald Hall kicked me out of his office and gave me my feedback, which he's the first doctor to give me my feedback. So I thought that was fun. And I was so upset. I was having trouble to get back down and get to my car. So a very kind female couple helped me, which I was very grateful for. So, yeah. So, but I have great doctors too. Specialists seem to suck the most. I think specialists get into specialties for the wrong reasons. They're the worst to deal with. I went to an orthopedic doctor recently. He did my x-rays and everything. Get this, he couldn't read the x-rays. He said, "I have to send these x-rays out to somebody to get them read." Have you ever heard of an orthopedic that couldn't read x-rays? I'm like, what kind of fresh hell is this? An orthopedic doctor that can't do x-rays? So I'm like, what kind of hell is that? And he wanted me to go see about these special leg braces. So I did go do that. And he's like, no, we can't do that. But it wasn't because he couldn't make it work. It's because I also have RA and I have osteoporosis. My bones are not good. So my bones will not allow it to happen either. So in the future, we don't know how long I have. My legs in the future will have to be amputated. My husband has a hard time accepting this. I don't have a problem with it because my knees down are extremely painful. They say that there is pain in missing limbs, but I figure every time my knees get bumped, it is so excruciating. It can't be as painful as all that. I mean, it's almost pass out pain when my right knee gets bumped. And if it gets moved wrong, they have to realign my leg and pull it outward because it cuts off the blood supply to my foot. So we have to constantly keep check for that. So when it gets bad enough, or if it crooks the wrong way and it cuts off that blood supply, that's when they'll have to amputate. Or if I get an infection in the blood in the lower leg. It's because all the bones in that region are disintegrating. And there's nothing left to hold the lower leg. This is what people don't understand. Yes, I can move my feet. I'm not paralyzed. But I have no bones in the knee area. None. Gone. They cannot be replaced. No knee replacement. There's nothing there. People don't get this. They don't understand that. Look at the links, okay? That's all I can tell you. Osteoporosis, RA, MS. I've had numerous injuries, okay? That's all I can say. You don't understand. You have to look at the bone spurs, the radiographs. I'm stage 4 in my knees. I've had reconstruction in one of my knees and in my lower leg on the right side. Didn't help. It got worse. There's nothing they can do about it. I can't help it. I can't tell you any more than that. I don't have any feeling in my feet. If I want to drive or if I want to touch something, I have to take off everything. I can't wear a sock. I can't wear a shoe. I can't even put on socks. I have to use an assistive device or have somebody do it for me because I can't bend my legs to put them on. I can't take them off. I'm physically disabled. People don't understand this. They don't get it. There are more injuries and more health problems than a spinal injury and being paralyzed. People need to educate themselves. I have to leave in 15 minutes. It's 3:00. So I'm going to have to end this. And there was so much more I had to say. And I really apologize. I wanted to keep my word and come on live because I promised I was coming on today. And I did not want to break my promise. But as you can tell, I'm so scattered in my thoughts. I had everything printed out or screenshotted, I'm sorry, to have notes. And I tried to make it easier by giving the links ahead of time. But it's just not working very well. And I'm scatterbrained and I'm all over the place. This is what MS does. This is what not being on the proper meds because of them not giving me my medication does. Let's find out what the glucometer says, because my dog's laying behind me. He's poked me 4 times. He's moved off the bed. He's laying behind my legs. He's been poking me in the back of the leg. He knows he's not supposed to come up here and disturb me while I'm on here. So he's been poking me in the back of the leg. So let's see what the glucometer says. 285. Yep, it's high. He's been back here. I silenced it. So he's been back here poking me in the back of the leg. Mom, you're high. You're high. Not high on high, but, high glucose. And there's a lot of people with service dogs that are saying, oh, this is low, this is high, and they're giving wrong information. This is high, but it's not horribly high, but yeah, it's high. A regular steady diet of this can hurt you, but this is not dangerous. I need to go to the hospital high. It's just over time, this number could do damage to my body. The 28th can't get here fast enough for me. I have been writing paperwork that I've had notarized. I've been in talks with an attorney. No, not my old attorney. He and I have cut from speaking to each other because of all those people on here slamming his name. Thank you all for that. My family, they are in possession of all of the evidence of what CVS is doing and has been doing to me in regards to me not getting my medications. So if anything happens to me, they have everything they need. So everybody out there right now, please research CVS owning Aetna and controlling what we can have and not have. I'm supposed to have a PET scan. It's in my rights as being insured by Aetna, but my doctors will not order it. Why will they not order it? Because they told me Aetna will not honor it. What good is it for us to order a PET scan for your cancer because Aetna will not pay for it, even though Aetna covers a PET scan? This is the bullshit I'm dealing with. You see how many medical problems I have. For every single medical problem I have, every medication I have, this isn't even 1/5 of my medications. There are problems. I spend up to 2 hours a day trying to put out fires just on my medical stuff. It's like having a job. I can't. It puts so much stress and strain. It's having a job, just trying to organize the doctors, the big pharma, all the things in between, and everything else. They don't give me my inhalers. They won't pay for my inhalers, even though they're supposed to cover my inhalers. They don't give me my insulins. If it costs more than a regular small pill, which my small pills, they've been charging me 3 times more than what they're supposed to charge. My regular pills that I take, they have to be in 90-day format. If the doctor's office mess up and it's not 90-day format, it doesn't cover it. I can only get my medicines through CVS because CVS owns my insurance company. So we are only allowed to deal with CVS. We're not allowed to get it anywhere else, or it's not covered. I wish I lived closer to Mexico. I can just go across the border, pay in cash for any medicine I want. Walk in, get it, go back home. It's to that point. It really is. I mean, it's really to that point. I don't understand it. I don't. And the person that made insulin said, I want everyone to have access to it. Here you go. I'm not patenting it. Free. And Big Pharma is saying, $300-$400 a vial. Give it. And then, some people are saying, the poor people can't get it. They get it through Medicaid. They're getting it. It's the people with private insurance that don't get it. It's the people with private insurance that are having the problem getting it because we don't get Medicaid. Just like, 6 years of, please take it out, please take it out. Oh no, we're going to aspirate you again. Ask somebody who is on Medicaid or on state or whatever they call it, how many times did they have to get aspirated before they took their thyroid out, or if they had to actually have cancer before they took it out? And you will find everyone you ask will tell you, no, they took it right out because they weren't a cash cow. They were not a cash cow for all these aspirations. They didn't have, to keep paying copays, and, their insurance didn't keep paying for it. So the doctor system and the hospital system is a big racket. And then you got the big pharma, and then you got the insurance companies, and now the big pharma owns the insurance company. And the Hippocratic Oath, the privacy is now the corporations, they can see what's going on. The doctors see what's going on. Everybody knows what's going on except for the patient. And they're telling the patient, don't tell your medical stuff. Don't tell your medical stuff. But everybody else knows. The only person that's hurting is the patient. It's all there. Just look it up. And also, go to my link. Demand all your medical stuff. Do not let them keep you from getting it. Demand all your medical notes. Go through it. You'd be surprised how many of my medical notes were wrong. They were wrong. They had my parents as living. My parents are dead. All my family's dead except for one half sister I have nothing to do with. They had my family as living, never having had cancer. They had me as smoking. I've never smoked. All my medical records were wrong. Get it all fixed because they're using wrong records to keep from being held responsible for their mistakes. Get your medical records, get them all fixed. I gotta go. Bye-bye. Oh, with the new camera, where do I get out of here? I have so many things here. The camera was covering the in stream. Bye-bye.